Hello, CES, and welcome to today's webinar with Align Modern Health. As we all know, we are in some really challenging times. Even before COVID, we all knew the struggle was real, but now the challenges can feel a little bit more amplified. Stress and anxiety and the lack of energy and motivation to do anything, stomach and digestive issues, mood swings, how we feel ebbs and flows like the weather in Chicago. And if you're tuned into the storm last night, that's kind of how things have been in 2020. If you're tuning in today, it's because you do care about your health and you know you can control some things and you want some positivity right now, some advice that will help you feel better. That's why we're here. Our message at Align Modern Health is to live life to the fullest, which is why we are taking this functional medicine approach with you to support your health and lifestyle, because it is ever so important now. Today, I have with me two of our most amazing functional medicine providers, fellow marathon and ultramarathon doctors, as well as friends. We have today someone who you might remember from our previous nutrition seminar, as well. She was a panelist at last year's Breaking Through the Wall event with Fleet Feet. She is currently in a virtual run across Tennessee. She practices out of our Deerfield and Park Ridge locations, Dr. Lexi Mykrit.
Hi.
Our other panelist today, he and I spent many a mile training for his first road race marathon at Chicago last year. This is after doing multiple trail ultra marathons. He enjoys rock climbing, pretending to be a cook, and from what I understand, he makes a mean guacamole. He and I are currently in discussions of running the Grand Canyon rim to rim sometime in the near future. He practices out of our Wicker Park location, Dr. Blake Butler. Welcome, doctors. All right. So for everyone tuning in, if you have any questions, please post them in the Q&A or comment section on the Facebook Live, and we will ensure we address them as we go. All right. So first, I'd like to help our audience by understanding what is functional medicine. Can you help us out with that, Dr. Butler?
Yeah, absolutely. And I'm going to share a slide too, just to better illustrate functional medicine. So quite simply, functional medicine allows us to think outside of the box as it relates to your health. We try to address the root cause of your health concern as opposed to putting a Band-Aid on symptoms. So we have to consider how your diet, your lifestyle, your environment, and your stressors can impact your overall health and well-being. And we know that health is multifaceted, so we can't just look at one condition and relate it to one cause. We have to consider all the potential lifestyle factors and variants that create dysfunction when looking at health. So to keep it really simple, I like to give a really easy demonstration. If you could imagine scratching your hand for 5 minutes, 5 hours, 5 weeks, 5 months, 5 years, it creates a lot of inflammation. And if you don't actually find out what's creating the inflammation and systematically remove those triggers that are creating the dysfunction, we can't actually recover and heal. So essentially, functional medicine allows us to understand what triggers are creating inflammation and dysfunction in the body, so we can take a proactive and preventative approach as opposed to a reactive approach.
That was a great explanation. That was awesome. That's a great demo. So majority of our goal races have been canceled, which of course can be crushing to the lifestyle we pursue. So how can we reframe this year so we're working to maybe be our best in 2021? Dr. Mykrit?
Yeah, with all the challenges that this year has brought us, it also has brought us some unique opportunities. When we're in the thick of a training season, we don't always have the chance or opportunity or time or energy to focus on things outside of our training block. And now that most of the races have been canceled for this year, if we shift our focus to what we could do to make 2021 better, is what we have within our power to change gears. So, for example, addressing some maybe chronic stress issues or gut issues or things like that we kind of have put on the back burner that we could train through typically, but now that we have a moment to step back and focus on our health, we'll be more in an optimal condition to hit the ground running come 2021.
I love that. I love that. All right. So how healthy is training for us this year, I guess, as it pertains to our immune system and overall health? Dr. Butler?
Yeah, great question. I would argue that training and movement is essential at this time, specifically with regards to our immune function. You may read that movement or exercise or training may not be recommended by certain providers secondary to concerns regarding immunity, but I would argue that I would rather have someone move compared to sit on the couch. So with that, a lot of questions commonly come to us regarding is running or training healthy? And if we really look at the literature, we find that running has a significant impact on reducing risk factors for chronic disease. Also, those who consistently exercise and who maintain normal activity develop a better immune response, have better general habits, and typically demonstrate a more holistic lifestyle because they're trying to support their training process. So just to illustrate that with some literature, I'll share another slide here just to walk through that, because I think this is really interesting. And I think it's a really good piece of information to have in your back pocket as a runner or endurance athlete. So if we really break down studies looking at large numbers of people, we find that we see a 45% reduction with regards to risk factors associated with heart attack and stroke, and a 30% reduction in general mortality, or essentially risk for dying of anything. We also find that running specifically long distances does not increase risk factors for osteoarthritis. I get that all the time when people ask why I would run, a long trail run, for instance. They'll typically say you're going to have bad knees, and I'll argue, well, that's not what the science says. So I think sometimes it's really helpful to have some literature. We also know that running supports brain function, specifically aerobic activity in general, so we can include cycling or other forms of cross-training. We find that they promote the secretion of what's called brain-derived neurotrophic factor. And this is a protein that helps protect our brain cells and promotes survival of our brain cells. And our brain dictates everything. Our brain's essentially the reality, or rather the lens in which we review our reality. So I think if we can establish movement to support brain function, that has a downstream effect on immune function, and we see this really beneficial.
I love that. Keep it moving. You gotta keep it moving. But so, there are some of us who will push hard, even harder right now with training, right? So we can always overdo it, but what are the real scientific results of overdoing it, Dr. Mykert?
Yeah, that's a great question, because how Dr. Butler just touched on, some providers may be discouraging people from running or movement right now, and that's kind of where the miscommunication comes in. If you're doing it right, you're training healthy, you're using coaches like all you guys do, you're doing it right for your body. But with all the stressors from life, from the world right now, a lot of us may be leaning on running and pushing ourselves, whether it's on the street or in the gym, more than we normally would, because it's an outlet for stress for a lot of us. But if we push too hard, not only do we run, common running injuries, we think of musculoskeletal injuries. So, shin splints, fractures, stress fractures, things like that. We also could lead to things like chronic GI distress, HPA axis dysfunction, which is a cortisol imbalance, which could then therefore lead to other hormonal issues too, nutrient depletions, things like that we may not be thinking of. And we're going to dive into all those topics today. So if we are overdoing it, how do we take a step back, reevaluate, and circle back to let's get ready for 2021?
That's perfect. I'm so glad you let us. That's a perfect transition. We're going to cover those three different things: GI distress, HP axis disorder, or someone might recognize it as adrenal disorder. We're going to touch base on that a little bit more, and hormone imbalances. So let's begin with GI, gastrointestinal distress. There's a fun, fancy word that is trending a little bit, and that is the gut microbiome. Can you explain that a little bit, Dr. Butler?
Yeah, absolutely. So if you're staying on top of health at this time, you've probably come across the gut microbiome in literature or blogs. And quite simply, the gut microbiome is the gut ecosystem. So essentially, we have trillions of bacteria and fungi within our gut, and these support our immune function. They support our mood. They support our ability to manage weight. They also support our cardiovascular function. So there's a lot of benefits to having a strong diversity of gut bacteria, assuming we have the appropriate bacteria. We also know that 2/3 of our immune system is essentially housed within the gut. Therefore, we take a significant look at gut function and gut health when trying to design an appropriate immune support panel or immune support strategy for individuals we partner with.
Oh, that's great. Yeah, so because it houses so much of our immune system. I understand there's a great percentage of diseases and things like that stem from our gut. About how many we're looking at, Dr. Mykert?
Yeah, so up to 90% of diseases can potentially be traced back to the gut, which, as Dr. Butler just mentioned, not only is the gut microbiome responsible for GI health, obviously those are the big things we think about when we think about our gut microbiome, but immune function, and not only just immune function, being able to fight off bacteria and viruses, but potential autoimmunity can stem from the gut, and other diseases like mood imbalances, a portion of our neurotransmitters, those are our happy hormones, things that control our mood, are established within our gut. So that can lead to things like anxiety and depression. As Dr. Butler mentioned, cardiovascular disease. There's very few diseases that if we don't take a step back and look at the gut, we won't see some improvements with. And that's, a big foundation of functional medicine is looking at gut health and seeing how it attributes to other diseases and processes that we don't necessarily correlate with just gut issues.
That's great. So let's actually identify all the or most of the problems or issues that would fall under GI distress. Dr. Butler?
Okay. So quite commonly we see irritable bowel syndrome as it relates to GI distress, but beyond the gut, we typically also come across more inflammatory bowel conditions that drive further dysfunction in our immune system. And essentially we can see the gut as the doorway to autoimmunity. So if you look at Dr. Alessio Fasano, he's got a lot of great research regarding how the gut acts as a doorway to inflammation. So if we really consider the whole body, as Dr. Mikra discussed, we understand that if the gut allows inflammation into the system, that creates risk factors for depression, anxiety, cardiovascular disease, any chronic form of illness. And a lot of that triggers stress dysfunction, and we'll dive into that in more detail because this is a pretty complex mechanism when we start to consider how the gut correlates with other systems. And I think we have to start with the gut just to make sure that we're ensuring an appropriate balance there before we really try to support other factors in one's health.
Okay. I think you might have covered that a little bit, but what causes the weakening of the immune system?
Oh, there's so many different factors. Specifically, if we go back to that trigger demonstration, driving inflammation, those individual triggers include poor nutrition, poor movement, poor sleep, high stress, pathogens or bugs. All of these different environmental and lifestyle factors can deplete our immune response. We also see subnutritious food coming from fast casual or fast food type environments create dysfunction in our immune system because they're not rich in nutrients. Non-organic foods typically aren't rich in nutrients that support immune function. So if you're not eating real food and you're eating food that comes in a package with ingredients you can't pronounce, you're probably not going to optimally support immune function. So with that, there's so many modifiable lifestyle factors that we can address to help support normal immune function, but the list goes on, and we'll dive into more as it relates to stress because cortisol, or stress hormone, has a significant impact on our ability to regulate our immune system.
Okay, great. What percentage of athletes experience gut issues, Dr. Margaret?
Well, most of us do. As endurance athletes, I'm sure most of you guys have had maybe 1 or 2 runs where you've experienced, some severe abdominal pain, need to run to have a bowel movement, things like that. Research shows that anywhere between 30 to 90%, which is the majority of us, endurance athletes experience some kind of gut GI dysfunction. So whether that be in the form of diarrhea or pain, or heartburn from eating the wrong foods, the majority of us are going to experience something. And that's why it's so important to stay on top of your gut health so we could try to avoid those flares. Maybe you're at a race and you have a food that didn't agree with you and it was out of your control. But how do we limit all the other stressors to our GI symptom to make this happen more and more or less common?
Okay, so I think you're alluding to that. And how do we limit those things? So what are some strategies that we can put into place to help with GI issues then?
Yeah, that's a great question. Ryan, I'm actually going to share a slide with you guys because that's so complex and so important for us. All right, are you guys able to see a slide that's titled Strategies to Support GI Issues? Awesome. All right, so this is very broad and basic and things you guys could all start implementing today. Of course, there's more specific things we could do. Functional medicine is very personalized medicine. So this is just, very foundational that we could all benefit from. But like any other system of our body, rest and sleep is going to be so important to repair. As athletes, we think rest is so important for recovery for our muscles. It's important for every other cell in our body as well. So that includes our gut. Rest and digest, not eating while we're sleeping, our gut is able to regenerate and be a little bit healthier. It's also crucial to support that microbiome that Dr. Butler was talking about. So ways we could do this, we could eat probiotic foods, things like kombucha, kefir, sauerkraut, fermented foods, things like that. But then we also have to eat something called prebiotic foods. Prebiotic foods are things that feed our probiotic foods. So it lets our microbes grow and thrive in the right way. Prebiotic foods are things like artichoke, chicory root, asparagus, things like that help these microbes grow in the right way. I'm sure you guys have all heard of probiotic supplementation. This may be indicated for certain individuals as well. Along those lines, eating fiber, we all know that fiber is important for healthy bowel movements. Now, some prebiotic foods are sources of fiber, so we're hitting 2 stones with that one. But keeping up your fiber intake is going to help regulate your bowels, support that microbiome. We also want to eat a big assortment of fruits and vegetables. Fruits and vegetables contain something called phytonutrients, which are antioxidant rich and anti-inflammatory. So to try to mitigate all the stressors and stress response within our gut, getting in these veggies and fruits are going to help do that. We also want to avoid foods that are going to have a negative impact on our gut. Gluten, dairy, alcohol, sugars, processed foods, things like that are going to hurt our microbiome. They're going to hurt our gut lining, which could lead to a cascade of other issues as well. You also want to make sure we're getting in vitamins and nutrients from our diet and supplement accordingly if necessary. Things like vitamin D, zinc, magnesium, glutamine is really important for our gut lining and our gut health, and essential fatty acids. You also want to eliminate any foods and any dysbiotic bacteria or yeast, any pathogens that are causing imbalances within your gut and perpetuating inflammation. And then lastly, it's so important to listen to your gut, which sounds cliche, but if there's something that you're eating that does not agree with you, don't eat that. It might be something healthy like broccoli or garlic or something like that that is causing a response to you, and you want to avoid that. And that's where we consider things like therapeutic diets or food intolerances, things like that. So you're really focusing on the foods that are nourishing your body, not foods that are going to harm your body.
Awesome. So what are some strategies like testing that you do as functional medicine doctors that might help us out here and understand our GI issues?
We have a lot of opportunities to look at the gut with regards to testing. Commonly, we look at comprehensive stool testing, and that allows us to understand the beneficial bugs and compare them to the not so beneficial bugs. And typically, if we see an overgrowth of bad bugs, we see symptoms of IBS, we see irregular bowel movements, we see bloating. In some cases, we can see heartburn. In other cases, we can see depression and anxiety. So we can actually send individuals home with a stool collection kit, which does not sound fun, and it's not necessarily fun. However, it provides us a lot of great detail. It allows us to look at the beneficial counts of bacteria, specifically species like Bifidobacterium and Lactobacillus that you may read on. It also allows us to look at different overgrowths that we want to specifically treat, as Dr. Micro discussed with regards to removing pathogens or removing bad bugs. Beyond that, we can take a look at really comprehensive protein testing. There are opportunities to react to food. Not everyone, however, has a food reactivity. So our goal is to understand how to eat in a way that supports the immune system and how to eat in a way that supports the gut lining. Gluten is one example. Not everyone needs to be on a gluten-free diet. However, there is a benefit to testing in situations in which someone doesn't express normal health. So just to share what a common gluten test looks like, we have the ability to really dive much deeper to really understand gluten beyond what's typically tested. If you consider celiac disease, for instance, you may look at wheat and alpha-gliadin. However, we have to go so much deeper to truly understand if someone tolerates gluten. We can actually look at different enzymes associated with gluten that correlate with gut dysfunction, specifically transglutaminase 2. We can see skin dysfunction associated with transglutaminase 3 and brain dysfunction associated with transglutaminase 6. And the reason we see so much dysfunction associated with gluten is because it breaks down the gut lining. And we see that allow different inflammatory proteins and processes to occur internally, and that has a negative impact beyond just the gut. So there's a multitude of other tests that we could look at, but I think there's a lot of value in understanding the gut microbiome and looking at the beneficial versus not so beneficial bacteria and yeast, and also potentially understanding if there's some type of reactivity to foods that stimulate gut dysfunction.
Yeah, I can attest to that the stool collection test. I'll tell you, it's really funny. I was with some friends this weekend who actually randomly we all did it, and it was just a fun story to talk about.
That's quite an experience.
It's an experience for sure. Anyway, so I'm going to move on to the next topic that we want to discuss, which you had said it was the HP axis disorder, or as some might call it, like adrenal fatigue or adrenal disorder. I do say adrenal disorder because it is a bit of a trending term. However, I know that there's some great area on the topic. Dr. Butler and I have actually discussed this even last year and how we label this. And there was even an article that was published recently asking if adrenal fatigue is a disease or pseudoscience. Dr. Blake Butler, would you help us understand this term?
Yeah, absolutely. So I don't actually like the term adrenal fatigue. However, it's commonly used because it's simple to understand. If you think about it from a very simple context, if you're overstressed, overworked, and not sleeping well and recovering well, your system can't respond appropriately. So we associate that with fatigue. And our adrenal glands produce cortisol, which is our stress hormone. And over time, there can be a dysfunction in the amount of stress hormone produced. However, we have to differentiate from disease and functional imbalance. So adrenal fatigue would really reflect Addison's disease, in which we just don't produce enough cortisol and then support is required. When we look at this in more detail, we have to look at the nuances. And we refer to this as HPA axis dysfunction because there's a miscommunication between the brain and our adrenal glands. And there's a lot of factors that can trigger that dysfunction, specifically poor sleep, poor nutrition, poor movement, or overtraining, as Dr. Micret discussed. These can all create a breakdown within that system, which has an impact on the immune system, which has an impact on the gut lining, which also has an impact on our ability to regulate hormones. So for those who go to a provider and say, hey, I'm feeling burnt out, I'm feeling fatigued, I'm not experiencing energy in the morning, a lot of times the provider will test and find normal markers. However, a lot of times that's not normal for the individual. So we have to look in the gray area and understand where the dysfunction occurs, and then really prescribe or develop treatment strategies to support that breakdown. Otherwise, a lot of people are going to go into the office and hear you're completely fine. You know, your adrenal markers are normal. Your cortisol is normal. You don't have Addison's or Cushing's disease. And they're sent away with no recommendation or instructions. So we're here to essentially look at this differently and determine where the breakdown is, determine where the dysfunction is, so we can support the HPA axis and help with that communication between the brain and the adrenal glands.
That's a great experience. Thank you for that.
Yeah, no problem.
So generally, we are stressing our bodies, and how much stress is too much stress, and how can and what can happen? What are the effects there, Dr. Micret?
So as Dr. Butler alluded to, so we could develop something called HPA axis dysfunction, and this presents itself in a manifest of different ways in different individuals. And that's why it's kind of more complex than just simply saying your cortisol is too low or too high. We test it throughout the day and what your cortisol response does, because cortisol should be highest in the morning and gradually taper out throughout the day. Now, what that curve is actually doing is going to lead to different symptoms. Like Dr. Butler said, some of the things are fatigue, poor recovery, poor sleep. Those are like the big hitters when you think cortisol dysfunction. But it could also be things like rashes or acne, changes in your hormone, changes in, for females, menstrual cycle changes, for males, changes in libido, headaches, appetite changes. So very many vast assortment of symptoms that present in the same way. So looking for some of these physical signs and stressors is a way to tell if you've had too much outside of doing testing. So if you're dealing with any of those symptoms, it's a great idea to get a functional medicine workout to see if cortisol is a little imbalanced in your body.
Okay, so you point out some markers that we can kind of look at ourselves, but how does a stress test work for us? Dr. Butler?
Yeah, I'd be happy to share that. So commonly, as opposed to looking at a single cortisol marker in a blood draw, we actually look at multiple collections throughout an entire day, so we can look at trends, as Dr. Micret discussed. And I'll share an example here because I always feel like it's easier to see this as opposed to attempt to share it without some type of visual. So with this, we can actually take a look at that trend or that graph that Dr. Micret discussed as it relates to stress hormone. So if you look at this here, and you can follow my mouse, normal would be within the green range. We typically like to see cortisol highest in the morning, and then we like to see it taper off into the evening. In this example, you'll notice that we have a normal start. However, there's certain points throughout the day in which stress hormone is relatively high compared to what is optimal. So in many cases, this allows us to determine where the breakdown is. It also allows us to better understand one's symptoms. For instance, if this were my patient as opposed to just a sample, I would assume this individual has a very difficult time falling asleep because you'll notice cortisol is elevated into the evening and it begins in the early afternoon. And typically, cortisol creates dysfunction in our ability to fall asleep and stay asleep because cortisol is inversely related to melatonin. So if you're just taking melatonin and not addressing the root cortisol dysfunction, you're really not creating a root cause solution. So this test gives us a lot of detail to understand where the breakdown is, but it also allows us to implement strategies at very specific times. And it gives us a better idea as to how this can impact other systems. For instance, if we look at DHEA, this is a precursor to sex hormones. We also know that cortisol or stress hormone can have a significant impact on our ability to produce DHEA, which regulates our metabolism, helps us balance our estrogen and testosterone, and then creates a cascade of either good function or dysfunction. So the testing is extremely valuable here, and this goes into much more detail. I won't go into all the nerdy information beyond this, but I think there's a lot of information we can glean from this clinically.
Oh, that was great. So how are ways that we can balance out the stress or limit our stress, Dr. Mykret?
So it's easier said than done for most of us, right? But stress is more than just emotional stress or stressors from the world. So obviously, emotional stress is one huge component of that, and limiting things like screen time before bed, doing self-care activities, finding things to complement stressful activities like running, which is self-care for a lot of us, but complementing that with some restorative yoga or something like that. But also limiting other stressors like stressful foods that are stressful. So foods high in toxin, inflammatory foods like gluten, sugar, dairy, things like that, alcohol, caffeine. Limiting those is going to support your stress response. Increasing those good phytonutrients that I mentioned before in fruits and vegetables is going to help your stress response. Eating throughout the day in regular increments. Combining food groups, so focusing on having a complete meal with a assortment of food, a healthy carbohydrate, good fats, good protein, things like that will help mitigate your stress response. It's important to realize that even though stress is high for most of us right now, focusing on the things that are within your control, finding different mechanisms to cope with stress is so crucial right now. So having those little mechanisms is going to go a really far way right now, even if you may feel like it does not.
Great. Dr. Butler, what are adaptogens?
Very good question. So adaptogens are very popular right now. You've probably heard of ashwagandha in particular. These are essentially herbs that help the body adapt to different stressors. So there's a variety of different herbs and mushrooms that can support our stress response. And commonly people implement these with teas, with powders or mixes. I find that there's a lot of benefit to introducing these if done at the appropriate time. So for instance, if we look at adaptogens, we commonly recommend them following the cortisol testing because we may want to provide certain adaptogens in the morning compared to the evening and vice versa based on someone's test result. So I've actually got an outline here of some adaptogens just so you guys can see what we commonly use. I'm really relying on that PowerPoint today.
I love it.
I'm really going for it. With that, we look at different adaptogens that you may read on. And essentially, my goal is to try to create diversity in adaptogen intake and then time it appropriately for the individual. But I also like to rotate every 6 to 8 weeks because the body's adaptable. And we want to make sure that we appropriately support the good adaptation to the stress response. So once again, we look at things like ashwagandha, which actually helps to reduce perceived stress and anxiety. We look at astragalus, which combats fatigue. We look at cordyceps, which is actually a mushroom, and that boosts stamina. This is commonly used in the athletic population, so you may really read on this or implement this in your training recommendations. But it's really independent on each individual, so I'm always cautious to recommend these generally. But there's some other benefits we see with regards to additional adaptogens like rhodiola and olivasol. This is not necessarily specific for each individual. I want to really highlight that because everyone has a unique response and needs different things. But in general, these are the types of strategies commonly used. So if you experience any irregular stress response, maybe consider ashwagandha. However, we have to be careful because some actually have nightshade reactivity and that can create joint pain or dysfunction and create further inflammation. So with that, it's always good to partner with someone who has some really strong knowledge on this to make sure that you're making the appropriate decision for you. But in general, I think there's some benefit to giving it a try, assuming there's no contraindication or reason from your provider that would prevent you from doing so.
Well, those are great. Actually, I practiced a little bit with cordyceps last year. So
cool.
that was great. It was actually recommended from one of our acupuncturists through Chinese medicine. So that was pretty cool.
Very cool.
So I want to talk a little bit more about our circadian rhythm. A lot of us know or are familiar with that. How consistent does that need to be though, to be effective? Like, can we have a weekday schedule versus a weekend schedule, and how does that work, Dr. Mykret?
So circadian rhythm is a tough one because as most of us know, your work week looks a little bit different than our weekends, especially when you're training. You're waking up early to get and log miles on the weekends on a Saturday, but then maybe Sunday you want to sleep in. So it's not as simple as, yes, consistency is key, but that's not realistic for most of us. And I think this is where it comes down to that personalized medicine, and knowing that how much stress you're putting on yourself is going to impact that. In an ideal world, we would keep your circadian rhythm constant, because your circadian rhythm is not only responsible for your sleep, it's also important for muscle recovery and your metabolism, your body temperature, other things like that, other physiological processes within your body. So yes, it will help you get a good night's sleep if this stays consistent, but it's also going to help you recover. It's going to help you stay healthy, bounce back faster, things like that. So as much as possible, it's great to keep your sleep schedule the same throughout the day. And this might even change throughout the year, because your circadian rhythm is triggered by environmental cues. So in summertime, when we have more hours of sunlight, it's going to be easier to stay up a little later, get up a little earlier, log those miles. But if you ever notice, like come wintertime and you're trying to get out of bed to drag yourself out into the cold Chicago winter to get a run in, it's not just your lack of motivation there. It's actually your circadian rhythm telling you to sleep a little bit longer. So listening to that as much as possible, so you're going to have the best outcomes for not only your sleep, which leads to reduced inflammation and better recovery, better metabolism, things like that. So as consistent as possible without stressing yourself out too much if you want to stay up and have a glass of wine with friends on Saturday night.
I was recommended to have a glass of wine with my friends on Saturday night. She just said, how does sleep then affect our adrenals, Dr. Butler?
Yeah, really good question. So sleep is essential as it relates to adrenal function. We need sleep to recover. That's where the reparative processes occur. And also we know sleep has a significant impact on our blood pressure, our brain function, our ability to manage weight. So even beyond the adrenals, we know sleep's essential. I know you're going to discuss sleep with other providers in the future, so I won't go into too much detail. But as Dr. Micra said, it's essential to try to establish a routine for you. I find for me, if I get less than 7 hours in the evening, for instance, I really struggle to function the next day. We know with regards to brain function that cortisol, which is stress hormone, has a significant negative impact on our prefrontal cortex, which allows us to go through higher order thinking, do complex things. And if we're not getting the appropriate sleep, we know our stress response is going to be irregular, and that's going to create frontal lobe dysfunction, and it prevents us from essentially normally going throughout a typical day and completing appropriate tasks. So sleep's quite essential. I could talk on this for a long time, so I'll stop rambling here for us.
Yeah, as you kind of alluded to, we are going to have one more webinar specifically on just sleep. There's going to be so much to cover there. But let's touch base a little bit more on that. So how can we maybe better optimize our sleep while we're here on the topic, Dr. Margaret?
So some things that we could all implement today, if you wanted to optimize our sleep, would be to establish a nighttime routine. Now, that may sound simple, but it is so important if you set habits to help yourself fall asleep a little bit better. This will include things like reducing your screen time before bed, having blackout shades to keep the light out, because that's going to support that circadian rhythm in the summertime when it's still bright out if you want to keep a different schedule. You could also rely on supplementation if indicated. So some of us, with the high stress environment of the world right now, we may need some extra sleep support. We could do this through natural ways, like with food, limiting your caffeine to the first half of the day, not having any in the afternoon, things like that. So looking at what you're taking in, that includes things like chocolate has a little bit of caffeine. So if you're more sensitive to it, evaluate your intake. Sugary foods, things that are going to rev up your inflammatory response are going to impact your sleep. Some of us need a little bit extra help. So talking with your provider about what kind of sleep support is indicated for you. Things like magnesium is a very mild way to support your relaxation. Then we could also use things like Dr. Butler mentioned, like melatonin or L-theanine, kava. There's a lot of different sleep support we could do. Also, within your nighttime routine, doing something for self-care. This is where that adrenal response ties in again. So if you're a meditator, things like meditating, maybe some bedtime yoga. One of my personal favorites is something called tapping. There's a free app called Tapping Solutions, similar to meditation, because it'll talk you through like a guided meditation, but it's more focused and it's easier for us that have a hard time shutting off our brain. So I highly recommend looking into that app if you need some additional sleep support. But again, doing it nightly, consistency is so key right there.
Oh, I love that. That's definitely something new that I haven't heard. So I definitely need to lean into that tapping app. Dr. Butler, can you talk to us a little bit about the metabolic reserve?
Oh, yes. So essentially, as we talk about stress, it can be frustrating when someone tells you to reduce stress. That's not always realistic as we go about our day. So my goal is typically to recharge the batteries. And we do that by feeding into the metabolic reserve. And quite simply, if you think about money in the bank that you have as a safety net, that's our metabolic reserve. It allows us to respond to stressors. It allows us to have the appropriate funds to spend to meet the demands of our stress. However, if we start to pull away from that reserve, we start to potentially overdraft. So our goal is to use strategies to build that metabolic reserve. And as Dr. Mike discussed, sleep and mindfulness are essential strategies to help build that metabolic reserve. Also, consuming nutritious, dense food and real food or whole foods is going to be an essential strategy to build that reserve, to essentially pad the bank account to make sure that you have the appropriate funds to meet the demand. So to keep it really simple, the metabolic reserve allows us to respond to stressors, and there's important strategies to help recharge the batteries or refund the bank account. And I know we've discussed a few of those, but understand that it's different for all of us. So for me, I use Headspace as an application, and that walks me through a 5 to 10 minute guided meditation daily. And I'll do that first thing in the morning outside, because that interaction with sunlight will help establish an appropriate circadian rhythm. So we can start to do really simple things on a day-to-day standpoint just to really feed into these mechanisms, and it doesn't have to be difficult. Like I said, I can only do about 5 to 10 minutes a day. That's where I'm at now, but I attempt to be consistent with that. And I think if you find something that you're able to maintain, you're going to draw a lot of value from that.
Yeah. We probably touched base on this a little bit before, throughout this whole topic, but how can we improve our rest and recovery, Dr. Mike?
Yeah, I do think we touched on most of this already, but just to summarize that a little bit, focusing on those bedtime routines, focusing on eating well as much as possible, increasing those anti-inflammatory foods, reducing those inflammatory foods, eating in a way that supports your blood sugar response, focusing on hydration and eating well on your rest days. I think that's something that a lot of us, we forget about. You have a long run, you're going to make sure that you're refueling, rehydrating, just as important on those rest and recovery days as well. Some of us may need to lean onto whether it be a protein supplementation or other anti-inflammatory supplementations to complement our healthy diet and lifestyle, as Dr. Butler mentioned before. Our standard American diet, our food availability that we have may not be cutting it. We may need to be supplementing some other stuff. So to really optimize those rest and recovery day, we just need to think about the foundations of health and make sure we're doing it not only on our training days, but every single day and night.
Love it. I love that. All right, great. So let's move on to the third topic, and that's going to be hormone imbalances. Dr. Butler, if you can help us out, what are some common hormone imbalances?
Yeah, commonly in females, we see things like PCOS, which is referred to as polycystic ovarian syndrome. We see low testosterone, which impacts energy, libido, and recovery in females as well as males. We also see thyroid dysfunction very commonly. And in many cases, we see patients who come in with significant fatigue, weight gain, and cold hands, cold feet, who have been essentially tested as normal as it relates to thyroid function. And if we really dive in deeper to understand the 26 patterns of thyroid dysfunction, we can typically understand where the breakdown is beyond just looking at what's referred to as TSH. So if you fit the bill for thyroid dysfunction, yet you've been told that you have normal thyroid function, consider working with a functional medicine provider, because we can actually typically find a breakdown within thyroid function. And stress, for instance, is one of the primary drivers of thyroid dysfunction in individuals. I know personally, I actually demonstrate hypothyroidism, so low thyroid function, which reduces my metabolism. And for me, if I'm regulating stress, I'm regulating my presentation. However, if I'm not regulating stress and I'm not doing the appropriate strategies to recharge my batteries, then I start to demonstrate further dysfunction in my blood chemistry. So if you look at thyroid function, for instance, that's one great example of where we often miss the boat with regards to treatment and recommendations and testing. In males, however, we commonly see low testosterone. And with that, we see low energy and inability to recover appropriately. We see fatigue in general. We also see low libido. So just some common things that we would see in practice. But thyroid dysfunction is one that we could spend months discussing. So I'll leave it there.
No, it sounds like there's and this is another topic we can go deep into. And I know you told us some signs, but Dr. Mike, can you fill us in with and help us understand what are some other signs of these imbalances?
Most definitely. I want to pull up a slide just because, as Dr. Butler alluded to, there is a lot of signs and symptoms of hormone imbalances. So looking at this slide, so some basic common hormonal imbalances, things like fatigue, sleep disruptions, things like that, but also decreased exercise performance. If you're not hitting your peaks and your PRs like you normally would, maybe we need to reevaluate your hormones and seeing if there's some endocrinology reason driving your poor performance. Menstrual irregularities are a huge thing with female endurance athletes. I'm sure a lot of you females have encountered yourself or know somebody who may have lost their menstrual cycle during an intense bout of training. That is something that needs to be supported. It's not normal as the media may portray it is for endurance athletes. We should be able to still cycle, and our fertility should not be impacted if you're taking care of yourself in the right way. But other signs are like constipation or diarrhea. So whether it's from cortisol and stress, pre-race nerves leading to you have to go to the bathroom right now, or your thyroid might be out of balance and you're having a hard time having a bowel movement. Muscle cramping, which is something, commonly as runners we associate with electrolyte imbalances or lack of hydration. It might be something more hormonally driving your muscle cramps, such as like your adrenal stress response. Immune system dysfunction, so we already talked about that with your gut health. So we know that if your microbiology within your gut is off, we're going to have poor immune response. But also if our cortisol or our thyroid levels are off, we might be more susceptible to viruses or bacteria. Skin and hair changes, that's a huge sign of either cortisol or thyroid. And then emotional aspect of it, we could have prone to irritability, loss of motivation, which a lot of us might be experiencing right now with our races being canceled. Maybe it's not just that, maybe there's something hormonally that's changed with all the chronic stress we've been exposed to the past few months. Poor concentration, brain fog, which we know can impact how we're working. So it's very diverse. There's lots of different signs and symptoms of hormonal imbalances. So it's not as complex as one thing or the other with this.
Yeah, that's you just touched base on a few different things that just had me thinking. Maybe that's something I need to go check out myself. But so how can you what creates these imbalances? Dr. Butler. Yeah.
That's a really good question, but a somewhat difficult question at times because, as Dr. Micra discussed, there's so many different variables. So just to tie it into the stress response to really refine on that in more detail, there's a process called cortisol steal in which the body draws from certain factors to help regulate the stress response and in turn creates an inhibition of sex hormone production, creating increased risk factors for breast cancer, fibroids, endometriosis. And also in females, we'll commonly see elevated cholesterol secondary to this cortisol steal, which is just an abnormal stress response impacting hormonal function. So stress has a significant impact on our ability to regulate hormones. Beyond that, we know factors in our environment, toxic foods, food reactivities or intolerances can drive this function by creating an inflammation response. We also know that exogenous factors from plastics, for instance, can impact our ability to regulate estrogen and progesterone by creating a dysfunction or imbalance. More importantly, and something we see very commonly, is blood sugar imbalance. For instance, if someone is trending towards diabetes or is pre-diabetic, we know that there's a process that is referred to as aromatization. So in males, we commonly see testosterone converted into estrogen as a response of that blood sugar imbalance. So we really have to look at all these things that we've discussed today as it relates to dietary modification, lifestyle modification, to support a normal foundation to address hormone dysfunction. If we try to go beyond that and just look at the hormone imbalance, we're typically going to miss the primary foundational issue. And we may improve symptoms by putting a Band-Aid on the issue, but we will never actually address the cause.
Yeah. So I know you did point out how to address some of the like cortisol, but how else are you also testing for these other hormones and imbalances?
I want to share my screen with you guys again to show you that, because that also is really complex. Give me one moment. Let me try to switch slides on us. All right, so with this, so I know Dr. Butler already showed us this adrenal test, but another one of my favorite tests that I frequently run in female patients is something called a rhythm panel. So in blood, we could test hormones, but with a female that is in menstrual age, hormones shift gears throughout the month. So being able to take a look at what the patterns of hormones throughout the month is super important. And this is something that I'm pretty passionate about. I can go on and on about, but for performance, for endurance athletes, can be impacted about where we're at in our menstrual cycle. So optimizing menstrual health and knowing where you're at in your cycle to help have the best performance is something that you most definitely could use to your advantage. And so a lot of times us females feel like it's a burden, but actually you have to see the flip side of it and know when our peaks and ups are and use that to your training advantage. We do a similar test in males, a saliva test that's just a one-day collection to look at their testosterone. Estrogen actually matters in males as well, so we're going to see how that's playing. We could also look at your thyroid function. So as Dr. Butler already alluded to, it's not as simple as hyper and hypothyroidism, which are pretty common medical diagnoses. We can have suboptimal thyroid functioning that presents itself in a vast majority of different ways, and interpreting blood work and looking at not only TSH, which is your thyroid stimulating hormone, but also your T3, T4, reverse T3, thyroid antibodies. I could go on and on. There's a lot of different ways we can evaluate your thyroid, that even if your TSH is perfect and optimal, there might be something else driving thyroid-like symptoms that we could help treat to help not only your performance, but your optimal health. So we do, at Alignment Health, we do saliva testing, we do blood testing. There's a lot of different ways to test your hormone, but it helps us providers figure out what's driving different things within you and treat it appropriately.
Got it. So there's a fun question that I heard before in the past, but speaking of like what might be driving certain things, what might be driving my chocolate cravings? Like, might I be deficient in something, or do I just simply love chocolate?
Well, you could just simply love chocolate and we'd all forgive you. However, for some individuals, we find that magnesium, one of my favorite nutrients, is commonly found to be deficient in cases in which someone craves chocolate. And specifically, we find that about 60% of the population demonstrates a magnesium deficiency or suboptimal magnesium levels when tested. We know that magnesium comes in multiple forms, and magnesium has an impact on over 300 different enzymatic processes in the body. So to say that magnesium is important is an understatement. Our body requires and needs that. For instance, if someone has chronic headaches, migraines, irregular mood, poor sleep, and irregular digestion, magnesium can play a role in correcting that imbalance. With that, to get into the nitty-gritty of magnesium, we want to make sure that we're using the appropriate forms. I'll be the first to say that not all supplements are created equally. I will not typically buy anything over the counter, just given that there's not FDA regulation or third-party testing in most cases. So when we're recommending forms of magnesium, we're using the purest forms. We're also using third-party regulated forms. Specifically, I like magnesium glycinate. Magnesium glycinate has an impact on so many different factors. It doesn't necessarily drive the softer stools or loose stools like the magnesium citrate, which draws water to the gut, but it does have an impact on our ability to sleep. It has an impact on our ability to regulate mood. It also supports migraines. So I'll commonly recommend, 400 to 600 milligrams of magnesium glycinate because so many are deficient. And typically we don't like to just guess. We like to test the blood to make sure that we need to support you there, because we could recommend thousands of different supplements. You could go online and search the best supplements for me, and you're going to get millions of opinions. But if we can actually define the appropriate imbalances with actual evidence, we can very specifically dose the appropriate form of magnesium, for instance, and the appropriate time. So I think there's definitely a lot of benefit to looking at magnesium because of its importance, but that's typically the deficiency we associate with chocolate cravings.
Yeah, that's great. I love that that supplement. That is something that I use as well. But other than the supplement, how can one get more magnesium in their diets?
So we already covered the chocolate, which that's a fun one because you know how a lot of females experience chocolate cravings during PMS? It's because their bodies are needing more magnesium. So if you wanted to try a different food instead of chocolate, if you want chocolate, no judgment here, go for it. But there could be other options for you. Nuts and seeds are commonly high sources of magnesium, in particular your almonds, your pumpkin seeds, cashews. And then some legumes, so like your black beans also, spinach, which is also a great source of a plant-based iron, so something that female athletes might really want to consider incorporating into your diet, potato skins, avocado, figs, so a lot of foods across the board have magnesium, and the most one, as we already talked about, chocolate as well.
Love it. Other than magnesium, what are some other nutrients that people often lack? Dr. Butler?
Yeah, so commonly when we test the blood chemistry, we find vitamin D deficiencies, and I would argue 85 to 95% of the patients. Dr. Microt, has that been your experience testing here in Chicago?
Most definitely.
Okay. Yeah, I find that specifically in Chicago, given our geographic location, vitamin D deficiency runs rampant. And vitamin D acts as a hormone in the body, which supports immune function. It supports our ability to regulate gut function and gut healing. And it also establishes the appropriate anti-inflammatory mechanisms that we're attempting to achieve by building a strong foundation in functional medicine. So that's a very common one that I see. I also see essential fatty acids that are typically associated with fish oils drive dysfunction in many individuals we test. So commonly we'll recommend wild-caught salmon, mackerel, anchovies, these types of fish that are low in contaminants. However, even with fish intake 2 to 3 times a week, I find that people are still deficient in their blood chemistry as we test these essential fatty acids, or specifically omega-3 fatty acids. So that's another factor that we commonly test. Also in athletes, iron is another factor that we see. Specifically in female athletes, I find iron deficiency. In males, sometimes we actually see iron overload though. So it's important to actually test this before we just support iron, because iron can drive oxidative stress and drive inflammation if used inappropriately. So there's a few factors there that we commonly see. It's also important to know that medications impact our nutrient imbalances, specifically oral contraceptives. They can have an impact on methylation or B vitamins and how we utilize them in the body. And B vitamins are important for our mood, our neurotransmitter regulation. Also, they're important for our liver's ability to detoxify. So when we look at these factors, we have to understand their important mechanisms and then correlate it with whatever signs of dysfunction we may come across in an individual we're partnering with. So those are very common ones that, for the most part, I expect to see, but there's a variety of other ones that we can test for in much more detail if there's an indication to do so.
I might kind of turn the topic a little bit to protein. Like how much does protein affect us, and how much do we actually need?
Yeah, no, that's a very good question. So as athletes, and specifically during a training period, protein's vital. However, I would argue that we don't need as much as some would indicate. So with regards to protein for males, I commonly recommend anywhere from 1.6 to 1.8 grams per kilogram body weight. In females, I'll recommend anywhere from 1.4 to 1.6 grams per kilogram body weight, but that'll really depend on the activity level and the recovery strategies. So with regards to protein, it helps us regulate our recovery. It helps us support muscle growth and development. It also has an important impact on other systems in the body because we get amino acids from proteins that impact our biochemistry. With that, some will argue that you can't get proteins from a plant-based diet, and I would argue that you can get complete proteins by combining different plants. So the goal is to work with someone like a registered dietitian or clinical nutritionist to really understand how to combine the appropriate forms of protein, whether that's from plant-based foods or animal proteins, at the right time to support your blood sugar regulation and your ability to recover from an athletic endeavor. So timing is very important. Also, the combination of proteins becomes very important. And for me, I do consume a little bit of meat, but meat's a side dish. So with meat, we find that it's a complete protein. And if you're going to consume animal protein, make sure that you're consuming it in its most natural form. For instance, I'll only purchase grass-fed beef. Wild-caught salmon, that was dinner last night. We had salmon with vegetables just to balance that out. So if you find that you're bringing in these things regularly with each meal and you're combining a protein with a healthy fat and veggies, typically you're going to meet your demands. But as athletes training, it's really important to understand what your demands are. And I think working with a coach or working with a provider to understand that better is very helpful. But also understand that you may not have to supplement with additional protein like we see marketed to us very frequently as athletes. You can typically get this primarily from your diet. And if you do need a supplement, then we want to try to find strategies to better regulate your dietary intake and patterns as well.
Yeah, I love that. Wow, use protein as your side dish. I love that. All right, well, to wrap up this topic on hormones, Dr. Microt, can you give us your top tips on just how to balance out our hormones?
So I'm going to start to sound like a broken record, but focusing on this, sleep again, the eating healthy, the stress management, that's going to be your number one baseline. Everyone will benefit from that from a hormonal standpoint. If you suspect you have any kind of hormonal imbalance, I would strongly encourage you to work with a provider that's going to help do some testing so you could support that. The tricky thing with working with hormones at any part of the endocrinology system is that they're all connected. Your thyroid talks to your adrenals, which talks to your sex hormones, and it's all a negative and positive feedback loops. So you want to find that area to support the most. So if you're going to do any kind of medication or supplementation, you want to make sure you're supporting the right hormones. And that's where testing comes in. So yes, proper diet, healthy eating, recovery, focusing on the things we covered on is a great baseline to keep you in track, try to keep you healthy. But if you suspect any irregularities or abnormalities, I would highly recommend getting some testing done so you don't guess and you're more accurate to streamline your training and recovery.
I love this. And, both of you have been kind of alluding this over and over again. I think that is the perfect way to kind of go about everything is that we don't have to guess. We can get tested and we can really, just do all the things that are necessary without overdoing things. So, all right. Well, lastly, can both of you give us your top overall advice? Maybe it's a short list of 3 or whatever for our athletes to maybe refocus this year, maybe to finish the year off strong and to go into 2021, even stronger.
Yeah, absolutely. So with that, it's difficult to narrow down to 3, but I find that if you're intentional with your time, typically we derive much more value from that. So with that being said, make sure as you establish training routines or as you bring things into your life at this time, you're very intentional about what you're saying yes to and very intentional about what you're saying no to. Because if you're able to say no to something, that may open the door to something really that's going to support your value system. So I think intentionality is one big factor that you need to consider with every decision you make, especially as it relates to training. Because I've been there. Time is of the essence as it relates to training, and we want to make sure we protect our time and do things that provide the most value. And that looks different for all of us. So that's my first recommendation. Just be intentional as it relates to your training and your time. Beyond that, quite simply, I'm going to recommend that we all do a better job of eating real food. And when I say real food, I mean food that comes from the earth or walks the earth. And if you are really interested in reading, there's a book called In Defense of Food by Michael Pollan. And I recommend this book more than anything else. It essentially breaks down food science and it talks about the flaws of studying nutrition. Nutrition, in fact, is one of the most difficult things to study in science, and we commonly pull apart these complex combinations of nutrients to study the individual part, and that misses the point. We see the benefit when we combine whole foods. So that book really dives into that in much more detail. And when I'm discussing this with people or patients in general, my recommendation is to keep it simple. To start, eat real food and avoid things that you can't pronounce, avoid things that are in a package, and avoid things that your grandmother wouldn't have in her cabinet. 50, 60 years ago, I should say. Beyond that, I recommend developing grit. And there's a research scientist named Angela Duckworth, who I really enjoy. She has this book called Grit, and I find that it really gives good information regarding perseverance as it relates to performance. So in general, just to summarize one key point of this, we find that those who are persistent with their goals and who maintain regular adherence to their practices develop significant results compared to those who may jump from one strategy to another. So I recommend starting with a team, starting with a coach, and establishing a plan and sticking with that plan to the best extent possible, as opposed to jumping toward every new opportunity or every new recommendation out within the wide interweb. That can be really confusing and daunting in my experience. And I'll also recommend sometimes taking a digital detox. I know for me, social media, for instance, doesn't add a lot of value. It creates more anxiety. And I find that it just doesn't serve me well as it relates to training and recovery. So I typically don't engage with that. And some do that very well. So I think find what works best for you and work to develop grit. And check out this book too. I think it's really interesting. It's been a few years since I've read it, but I remember really enjoying it at that time.
That's awesome, Dr. Butler. To piggyback off you a little bit and what you were saying about the social media detox, focusing on positivity, which as a world, as a society, that's not something that we're being right now. But every single cell of our body is listening to every single thought that you have. So from an inflammatory standpoint, from a sleep standpoint, recovery, mood, all the things, if we are being perpetually negative, which a lot of us are, you and I don't blame you one bit, but shifting our mindset to being more positive and focusing on the good right now is going to help not only your performance come heading into the new year, but also help you maintain overall health, support your immune function, support your recovery, all those things that we want to work on. And the other big thing I would want to challenge you guys to do, determine some health goal outside of running. So I know all of us as endurance athletes, running is always our first and foremost. And, as a physician and an athlete, whenever I go to the doctor, I lead with, I'm an endurance athlete. So whatever's going to happen, you better cater to that. I get it. But we have this unique opportunity right now without races, which stinks. It really does. But if we shift gears to focus on maybe some chronic digestive issue or headache or menstrual issue, something that you've never had the time to focus on outside of a training season and recovery's sake, focus on that and see how we could resolve it or improve it to set up 2020 as an even better year. So use this time, be positive about it, and try to just optimize your health all over, not just as an athlete right now.
Oh, you both closed so strong. That was so good. Amen to both of you on the social media thing. I'll admit, like, I've kind of taken a back seat on that a little bit because of just where we are right now, and that's minus some of just the private groups that we're in, because a lot of the private groups can be real uplifting and positive. So I do see that, and Angela Duckworth, she's been on my queue of authors to follow up on, and I've seen her on different podcasts, so she's wonderful. But thank you so much, Dr. Lexi Mykret and Dr. Blake Butler, for coming out and talking with us today. So many good takeaways. I know I am looking forward to implementing going forward. Everyone, I hope you were able to intake all of the great knowledge and advice that was shared today. Remember, it's not the end because the marathon was canceled or your race was canceled. Running and a healthy lifestyle is not canceled. We can always improve on both, and hopefully you can use the rest of 2020 to figure out and fine-tune some things to be your best in 2021. What an awesome comeback story that will be. If you are interested in learning more and want to see either Dr. Mykret, Dr. Butler, or any one of our amazing team of providers, we are open for in-person services as well as telemedicine appointments. We are in network with most major insurance carriers, and we do a complimentary insurance verification for you, so you know upfront what the costs are associated. What the costs are associated. As a CS athlete, you do get a 10% off discount off of all of our self-pay services. Massage therapy is back. Just remember to mention that you are a CS athlete when you do go to our website at alignmodernhealth.com to schedule your appointment. Until then, stay healthy, stay safe, stay active. And this is Coach Ryan, and we hope you live your life to the fullest. Thank you.
Thanks, guys.